Welcome to CCPU Healthcare Fund Benefit Overview. Please be patient. We'll be starting here shortly.
Al resumen de beneficios del Fondo de Pensión Médica, CCPU. Empezaremos dentro de un momento.
Everyone can see we're together as we walk on by, and we fly just like birds of a feather. I won't tell no lie. All of the people around us, they say, can they be that close? Just let me state for the record.
Good evening, CCPU family. Please use the chat wisely. Let us know who you are and where you're coming in from. We will be starting the Healthcare Benefit Fund overview shortly.
موارد شده صحت او د ماشومان د صحت په باره کې خپل خبره شروع.
مرحبا بكم جميعا. سوف نبدأ في دقائق قليلة.
Go ahead, my sister Patricia.
Bienvenidos al resumen de beneficios del Fondo de Pensión Médica CCPU. Comenzaremos muy pronto. Por favor, dejar en el chat de dónde son, de qué condado, de qué ciudad. Gracias.
تاسو اوس یو سندره اورئ چې دغه هر وخت چې څوک خبرې وکړي په انګلیسي ژبه هغه په پښتو واړوم یا ترجمه به یې کړم.
جميعا سوف نبدأ في خلال دقائق قليلة، وسوف نخبركم بأي قناة تختارونها لسماع اللغة العربية.
اطولات پښتو وایي یا دري وایي؟
Good evening, family CCPU providers. Welcome to the Healthcare Fund. Please utilize the chat and let us know where you're coming in from, where you're visiting. We'll be starting here shortly.
خراغست وایم نن و CCPU کیو او لهر زاینه چې تاسې زمونږ خبره اورئ خپل نوم هلته ولیکئ. تقریبا 1500 او 40 کسان مونږ سره اوس شریک شوي دي.
Bienvenidos al resumen de beneficios del Fondo de Pensión Médica CCPU. Por favor, dejar en el chat de dónde son, de qué condado nos están acompañando. Gracias. Empezaremos muy pronto.
اگر شما به زبان فارسی یا دری گپ میزنین هم میتوانین ترجمه ما را از قبیل از طریق چینل بشنوید. تقریبا ما فعلا حدود 80 زبان داریم که میتوانند به زبانهای خود بشنوند.
مرحبا بكم جميعا، وليخبرنا كل شخص من أي مكان أتى، وبعد ذلك سوف تكون هناك ترجمة باللغات مختلفة ومنها اللغة العربية. ولسماع اللغة العربية اختيار القناة باللغة البرتغالية، وسوف نقول لكم التفاصيل فيما قليل.
dhammaantiin kusoo dhawaada CCPU providers. waxaan kaga hadli doonaa barnaamijkan fundska loogu talagalay caafimaadka. mar dhow ayuu noo bilaaban doonaa. waxaan idinku turjumi doonaa luqadda Soomaaliga. waxaana ka dooran kartaa luqadda Japanese ayay dhihi doontaa markaas ka doorta si aad u heshaan turjubaad Soomaaliya. Waa mahadsantihiin.
Ողջունում ենք ձեզ միանալու այս վեբինարին CCPU առողջապահական խնամքի ֆոնդին վերանայելու նպաստները։
Good evening, my brothers and sisters. Welcome to CCPU Healthcare Benefit Fund. We will be starting here shortly.
Ողջունում ենք ձեզ միանալու այս
زتولت
CCPU
سلامون وران دکوم
Buenas tardes a todas, a todos, compañeros, compañeras, proveedoras. Dentro de muy poco vamos a comenzar. Bienvenidos al resumen de beneficios del Fondo de Atención Médica y muy pronto vamos a comenzar con esta magnífica información. Gracias.
Good afternoon, evening, fellow sisters and brothers of CCPU. Welcome to CCPU Healthcare Fund Benefit or Overview. So, to access the interpretation on the computer, at the bottom of the Zoom screen, select the globe icon for English.
Buenas tardes, compañeros, compañeras, proveedoras. Vamos a empezar con las instrucciones para acceder a la interpretación por computadora. En la parte inferior de la pantalla Zoom, seleccione el globo español como su canal de idioma.
To access the interpretation on a tablet or smartphone, look for the three dots or more. Choose the language interpretation, then choose your preferred language option and click Done.
Para acceder a la interpretación por tableta o teléfono inteligente, buscar los 3 puntos más, seleccionar interpretación de idiomas, seleccionar español, hacer clic en finalizar.
For English, select English.
Para español, seleccione español.
For Salam, Hasho.
So for the Armenian language, folks are going to select Chinese, since the interpretation has already started. So if you speak Armenian, please select the language Chinese to be able to hear it. For Somali, you're going to select Japanese. For Pashto, you're going to select German. And for Arabic, select Portuguese. But the interpretation has now been launched.
Thank you, Ignacio. At this time, it gives me great pleasure to introduce Marche Jones, Director of CCPU Healthcare Operation and Key Accounts.
Hello, everybody, and good evening. Again, my name is Marcia Jones. I am the Director of CCPU Operations, and I'm here with you tonight to tell you about CCPU benefits for the Healthcare Fund. So first, what we'll start by doing is I'll review the agenda. We'll do a program overview to give you a level set on what the program is about. We'll talk about who is eligible. I'll then launch into reimbursement program benefits, and we'll talk about what benefits are actually afforded to providers who want to enroll in this program. And then we will deep dive into dental and vision with a quick overview of what those benefits are. All right, so to start, program overview. So let's take a look at how the reimbursement program started, and then we'll discuss how to actually get enrolled. All right, the CCPU Healthcare Fund is a healthcare trust governed by a board of trustees. The trustees are appointed by SEIU Local 521, SEIU Local 99, and the United Domestic Workers and AFSCME Local 3930. Through our reimbursement program, we work with providers' current medical insurance plan to reduce, or in some cases, eliminate out-of-pocket healthcare expenses. In short, the reimbursement program was designed to save providers money. The expenses we can help with are out-of-pocket costs for medical care and prescription drugs, including copays, deductibles, and even your monthly premiums. As you know, these expenses can be quite costly and add up over time. So receiving a reimbursement for things like doctor's visits can be an incredible savings. So let's start with how we got here. So as you may have heard, after challenging collective bargaining between the state of California and CCPU, the state agreed to provide $100 million to help eligible child care providers reduce or eliminate their healthcare expenses. The $100 million is what we use to reimburse you for eligible expenses. One thing to keep in mind is that the CCPU Healthcare Fund's reimbursement program is not health insurance. It does not provide medical insurance, and it does not replace a provider's current health insurance plan. It is, in fact, a reimbursement plan that helps you pay for eligible health expenses. So in other words, if you as a provider have health insurance, you should not cancel it. In fact, providers cannot actually even enroll into this benefit program unless you're enrolled in a qualified health insurance plan. But if a provider is not insured, don't worry. Providers can enroll in a qualified health plan and then receive reimbursements from our program. The takeaway here, everybody, is that not having insurance is not a barrier to being able to take advantage of these benefits. And we'll talk a little bit about that in a few slides. In the meantime, if you are a provider who does need help either enrolling into a health plan or even maybe changing your health plan, you can go to ccpuhealth.org/help-enrolling for more information. Okay, let's talk about who is eligible for these amazing benefits. The CCPU Healthcare Fund's reimbursement program is available to providers who meet all of the following requirements. You have to be, 1, paid for working with a state-subsidized child, enroll or be enrolled in a qualified health insurance plan, and you have to do a very simple thing, which is submit an application. It's really that simple. There is no cost to providers to enroll into this program. And again, I like to stress this whenever we talk about the program, it's for childcare providers. Other participants in your community cannot take advantage of these benefits. This is a fund established specifically to help with your out-of-pocket costs. So let's discuss each requirement in a little more detail. All right, to start, providers must be paid for working with a subsidized child. A subsidized child is a child for whom a family receives government-sponsored financial assistance expressly intended to pay for childcare. For providers, this means their fee to care for childcare is reimbursed in whole or in part through a government assistance program. The subsidy must come from a qualified state-funded program. Local or county-funded assistance programs do not count towards qualifying for the benefit. It's a very important distinction to understand because we know there are a plethora of different programs that actually subsidize childcare. This program accepts only state-funded subsidized payments. All right, to determine a provider's initial eligibility, the fund will look back at the 6 months prior to when the provider applies for benefits to see if they were paid for work in at least 3 months with subsidized children. If the provider is not eligible right now, they can become eligible later. This is why it is so important that even if you feel that you don't qualify for this benefit today, you still do an application because we have the ability to reassess you as time goes and to contact you when you have gained eligibility. To continue eligibility, once you've been granted initial eligibility, the provider must have been paid for work with a subsidized child in at least 1 month out of 3 months in the look-back period. All right, the second piece of criteria is that a provider must be enrolled in a qualified health plan. Qualified health plans include those offered through Covered California, Medicare, an employer-sponsored plan, Medi-Cal, Medi-Medi, Veterans Affairs Healthcare Benefits, and even TRICARE. Fund benefits are available for every eligible provider, regardless of the type of qualified health plan they have. And as I mentioned earlier, if a provider is uninsured, there's no need to worry. You can always visit ccpuhealth.org/help-enrolling for help enrolling in a qualified health plan. All right, and the third piece of criteria, which is also the easiest, you just have to complete an application. Applications can be submitted online, or as a provider, you can contact the office, the fund office, to request a paper application, or visit the website and download a paper application. Applications typically take about a week to process, and we follow up to make sure we get you across that finish line. Okay, now we will review the specific benefits available to providers who are enrolled in a qualified health plan. As a reminder, these are health plans available under Covered California, Medicare, employer-sponsored plans, Medi-Cal, Medi-Medi, Veterans Affairs, and TRICARE. If a provider does not have health insurance now, we will cover in just a few minutes how you can actually get enrolled. All right, so depending on the qualified health plan, the CCPU Healthcare Fund will reimburse different expenses. For most qualified health plans, the fund will reimburse up to $9,450 annually for out-of-pocket expenses. Out-of-pocket expenses include medical and pharmacy expenses, such as copays, deductibles, and coinsurance. Expenses for dental and vision are currently covered, and we'll talk about that in just a few moments, but are not covered using your CCPU healthcare reimbursement debit card. That is a very important delineation. Only the provider's own expenses are eligible, so dependents, spouses are currently not covered in this program, so those expenses are not reimbursed. For certain qualified health plans, the fund will also reimburse some or all of your premium expense. I want to point out a few plans' specific items. To be eligible for reimbursement program benefits, providers enrolled in Covered California must be enrolled in a silver level HMO plan. If a provider has a second job, for instance, that offers health insurance, they are not eligible for benefits from the fund if they have employer-sponsored insurance through a Covered California plan. They are only eligible through the employer's health insurance plan. Now, for providers who are enrolled in Medi-Cal, for instance, the fund will cover $100 per month for Internal Revenue Code 213D, permissible healthcare expenses. Permissible healthcare expenses can include things like braces, glasses, over-the-counter aspirin, and items of this nature. This benefit is a little different from the other qualified health plans, since Medi-Cal often pays 100% of premiums and out-of-pocket expenses for participants. The permissible healthcare expense benefit is available only to providers who are enrolled in Medi-Cal or Medi-Medi. It is not available to providers who are enrolled in one of the other qualified health plans. Right, and I'm just gonna go ahead and cycle through to show some of the other plans and what their benefits are. What's important, again, to highlight for everyone is that your benefits are directly related to the qualified health plan type you are enrolled in. If you want to review this information, this is also all available on the website at ccpuhealth.org. Okay, so for providers who do not have health insurance, the fund can also refer them to an enrollment specialist who can help find an appropriate qualified health plan for them. So based on the health plan you enroll in, you will receive fund benefits that align to the benefits that we just reviewed. Again, for more information about qualified health plans and getting enrolled if you are currently not covered, please visit ccpuhealth.org/help-enrolling. All right, and so one of the new developments is that as of July 1st, 2024, the Board of Trustees for the Healthcare Fund have made available dental and vision benefits. Here are some important pieces of information to note regarding eligibility. Benefits are currently being provided by MetLife. Providers do not need to actually do anything to enroll in dental and vision benefits. If you enroll in the healthcare reimbursement program and are approved and active, you are automatically granted these benefits with your reimbursement program. There is no separate application. And you cannot enroll in dental and vision separate from the reimbursement program. So again, your dental and vision benefits are coupled with your healthcare reimbursement program. They are not separate. You cannot enroll in one and opt out of the other. And then for more information about those benefits, you can visit metlife.com/info/CCPU for more information. Additionally, we also offer information regarding CCPU dental and benefits offered through MetLife on our website, listed here, or again on MetLife's dedicated website, specifically for CCPU providers, that talks about these benefits. Okay, so what I'd like to do now is introduce my counterpart for this presentation, Mr. Neil McMahon, and he is going to talk to us about these MetLife dental and vision benefits. Neil?
Thanks, Marche. Just confirming you can hear me okay? All right.
I can.
So thank you, everybody. I'm thrilled to be here, Marche. We're just going to jump to the next slide and we'll get into this. We're going to go over some more detail about the dental and the vision plan, talk about how you can access the benefits, where you go online, how the benefits work. We'll kind of go through some more detail on all that. And as Marche said, if you've got further questions from that, a lot of this information will be on the website as well. So this is a fantastic benefit that the fund has been able to provide. There's no cost, as Marche said to you. You don't pay anything from a premium perspective. And even more important, we'll get into this a little bit, but these plans are designed to deliver no out-of-pocket costs for you. So when you go to the dentist, when you go to a vision provider to take advantage of these plans, the plans are really designed to pay for 100% of what you're going to need. And so they've been structured to basically pay for as much as possibly can be paid for. And that means $0 copays for regular visits and things like that. So these are really, really valuable benefits, very rich plans. I've been doing this for almost 30 years and I've seen hundreds of plans, and these are absolutely kind of at the top of the list. So very, very excited that we were able to make all these work and love partnering up with the fund to deliver these to you. So without further ado, let's kind of jump into it on the next slide here. So before we talk about the exact benefits, this is going to be your hub for your personal benefits with the vision and the dental. You can go into metlife.com, my benefits. This is where you will register as a user. Once you're enrolled in the plans and your application's been approved, as Marche said, there's no dental or vision application. You're automatically on these plans. And we do add everybody weekly. So you give that week for processing, and then you'll be added into the plans. And once you're added into these plans, you're going to be able to come in here, register yourself. You kind of establish your own username and password as you would with most sites. And then you're in. And this is really where you're going to be able to access all the information about your particular plan, your usage, those kinds of things. So obviously you'll be able to see yourself enrolled there. If you've had a recent claim or you're looking for information on a claim, you'll be able to see it here. ID cards is something that comes up a lot. Certainly you're going to mail you an ID card for the dental. The vision doesn't require one, but you'll have the ability to get one here. And you can just print it straight off. I know a lot of people will just take it, download it, and they can use it on their phone. And so, in addition, any additional forms, you may have some questions about, I'm not sure what the dentist is talking about here, and I'm looking for some definitions on what all these terms mean. I'm not a dentist, and I've been doing this for a long time, but I get confused sometimes with a lot of the terms and stuff. So there's good educational tools in here to help you understand what's going on as far as that. The nice thing about this is it's available here on the website. In addition, there is also a MetLife app that you can download, and it'll essentially give you the exact same information, the exact same ability to access your own data, those types of things. And so you've got access to the information wherever you need to get it. So that's going to be the place you'll want to start. We'll talk about how you can search for provider or dentists or vision locations, all of that here in just a little bit. So let's go ahead and jump into the actual benefits on these plans. So first we'll touch on the dental. So for the vast majority of providers, you're going to be on the dental HMO plan. This plan is available all through California. There's nearly 15,000 dentists that are on this plan, so you should have no problem finding a dentist out there to use. And once again, this is designed to offer extremely low out-of-pocket cost to you. There's no deductibles, there's no annual maximums. If some of you have been on other plans, you might run into where, oh, I've used all my benefits for the year and then I have to pay for all of it. This doesn't have that. It basically what the coverage that you need, that's the coverage that the plan's going to give you. No claim forms to complete when you go to these dentists. They'll take care of all the paperwork for you. The one thing that we do ask under this plan is that you do have to go to one of the participating dentists. Like I said, there's 15,000 of them across the state. These are top quality dentists. I know sometimes people will be like, well, wait, if it's a network dentist, what's gonna happen to me? These are really top quality dentists. We do a lot of vetting of them, and we ongoing monitor them, make sure that their practices are running correctly and that they're doing the right kind of work. So you can have real confidence that those providers are the ones that you should be going to. The one exception to going out of network is if you have a dental emergency and you need to have some work done and there's no dentists nearby that are in the network. So you may be traveling, you may actually be in an area where there happens to not be a provider. And so those are times when you would actually be able to go in and have the emergency work done. And typically in those situations, they're going to give you stabilization, make sure everything's okay, and then you can follow up with your dentist at a later date. And we'll talk about here a little bit more in detail in a sec on what's actually covered on this plan. It's great to have this plan that doesn't cost you anything, but if it's not covering the things you need, it's not going to really do you a lot of good. This plan covers over 400 procedures, and that's at a zero copay. So when you go to the dentist and they perform the work, once again, you're going to have a $0 copay for that. And that starts with your visits. You're going in for regular cleanings. You have to have a tooth pulled. You've got to get a filling done. All those things are going to be covered with these $0 copays. So really, you're going to have no out-of-pocket on most anything you're going to have done at the dentist. So let's go into a little bit more detail on that on the next slide here. This is just a little bit more of a list, and the full listing of all of this is available on the websites. So you can download a kind of a full, what we call an explanation of benefits, where it's all the covered services, and you can see that over 400, there's a listing of all 400 of them, so you can see what's there. But this is a lot of what most of us are going to have done at the dentist. So you've got preventive services, which is what if you're going to see the dentist regularly, you go in for an exam, cleanings, maybe having sealants, if you need to have x-rays taken. I know a lot of times the dentists will take those each time you visit. Fillings, even crowns are going to get covered with $0 copay, and that is one of the most tremendous benefits I have ever seen on a plan. I don't think I have another one of these plans that covers those at $0 copay. Root canals, certain things, if you've got to go see a specialist like a periodontist or an endodontist, that's covered as well. Also things like general anesthesia, surgical things, all of these are going to be covered under this plan. So it's a very broad plan, and once again covers these at $0 copays. And it's I've talked to a few of you at some of the on-site events, and I know it seems like it's too good to be true. I thought so too when we started working with the fund to put this plan together, but this plan is legit. It really does cover all this stuff, and it really will cover it at $0 out of pocket for you. So it's fantastic, and I strongly recommend taking a look at it and really understanding what's there and what's the value there. So great plan, good coverage. How do you get to it? So we'll talk about how to find a provider that's near you. So on the next slide, just a quick example, you can find these at a couple of different places. And Marcia, if you could jump to the next slide, it may be stuck. Oh, I'm sorry, I jumped ahead there. One more thing for us. Yes,
Hey,
go
Neil,
ahead.
sorry to interrupt. We are getting requests if you could slow down a bit.
I'm sorry, I will definitely slow down. I get so
Thanks.
excited about this. It's I will take a deep breath and I will slow down. So for some of the providers out there, the fund has done a really good job of keeping an eye on where you live and the network access, because obviously with the DHMO plan, you need to have access to DHMO providers, and there's a very small percentage of you, I think it's about 3%, that live in more remote areas, more rural areas, where there just aren't enough DHMO providers to give you good access. And so the fund has been good enough to include a PPO plan, which allows you to pick any dentist, although you do have a little bit of limitation from the amount of benefits that are available. But it does cover the same broad amount of services and also designed to cover 100% of your cost up to the annual maximum of $1,000 of benefit. And this is not, you don't have to worry about which one am I supposed to be in, because the fund is watching this very closely on a regular basis. And if you land in an area where there isn't DHMO coverage, you'll automatically get defaulted into the PPO plan. And then when you get the communications from MetLife, it'll identify that plan. So you don't need to worry about it. If you're in this plan, you'll know it. And if you're in the DHMO, you'll know that as well. Okay, so we'll go to the next slide. So how do you find these providers? You can do this in two different places. You can go just to metlife.com, which you don't need to be logged into. You can also do the same search on that My Benefit site, where you register and you log into your own personal account. So you can do it in either place. And what you'll do when you log in here or you go to the metlife.com site is you'll just click on this. You'll see this exact piece on the screen. How can we help you? Click on Find a Dentist. And then if you flip to the next one, then you will select which network you are in. Once again, virtually all of you are going to click on that Dental HMO Managed Care button. For those of you that are in the PPO plan, you'll push the PDP. It will take you into a network search function. Very simple. You'll basically be able to put in your zip code. If you happen to know a provider's name, you can search by the provider's name and just go ahead and hit the Find Dentist button, and it'll bring you up a list of those dentists that are closest to that zip code, and then it'll give you a kind of a distance search from there. So you get the closest ones first, and then from there it will go out farther and farther, and so you'll be able to pick from any of the dentists that are in that list. For those of you who are in the HMO, the DHMO, you will select a provider before you go to the dentist. And that's real simple. You do that on the My Benefits when you log in. If you haven't selected a dentist, it'll ask you to go ahead and do that, and you can follow the instructions there. Very simple to do. You can run through the search, pick one you like, and that'll be the one you select, and then you'll be able to use that dentist. You're not required to keep that dentist for any length of time. If you maybe go to a dentist and you decide I want to go to a different one, you're welcome to do that. You can change just by going in and selecting a different dentist as you go forward. So that's how you access it. So switch over to the Vision now. And the Vision plan, we'll get into the details, but designed in a very similar fashion, that the intent is to pay for as close to 100% of your costs as we possibly can. And this includes, similarly to the dental, where there's a lot of covered services, this has a very broad range of covered options for your glasses. So we'll get into it a little bit on the next slide, but things like UV coating, some of the shattered resistant lenses, things like that. I know it says here for children, but I know those are for all of us. I've got 2 adults in my house that wear glasses, and both of them have shatter resistant lenses because they've broken them before. So, and in addition, you've got a great selection of vision locations to go to. Lot of the larger chains. So I know the ones that typically come up, Costco, Walmart, a lot of us use those for vision because they're such great value, covers those. And also a lot of the other chains as well. In addition, and one of the reasons why we love this plan so much is it also gives a lot of local vision providers and some of the smaller offices that are out there. I know that's where I personally go. I like to be able to go into the office and see the same person every time. This gives you that option as well. And finally, if you, maybe your brother, your sister, your uncle, your aunt is a vision provider, an ophthalmologist, you want to go see them and they're not in the network, you actually do have some out of network coverage. It won't cover quite as much, but if you've got somebody and you just absolutely don't want to change, you can still have the option to take care of some benefits there and take advantage. So let's jump into what it actually covers here. So I'll explain what we're looking at here. So down the left side, you've got the different types of benefits or the coverage. The next column is in network. So if they're in the MetLife network, that's what you're going to have covered. If you choose to go out of network, you'll see that in that middle light gray column. And then on the last one is the frequency. So how often can you take advantage of these benefits? And you'll see all of those are 12 months on the frequency. That is another area where this plan is really rich and provides a tremendous amount of benefit. A lot of these plans will only cover new frames, new lenses once every 24 months. So the fact that you can go once a year and get a new set of glasses, that's really great. And I know, we're tough on our glasses sometimes, and, going an extra 24 months can sometimes stretch them out past their wear. So the fact that you can go in once a year, fantastic benefit there. Eye exams covered in full. Materials, which is basically your frames, up to $150 allowance. That's greater than almost all the plans. Most of our plans are only at $130. And then you even have an additional 20 on some of the featured frames when you go to one of the locations. There's certain brands that will pay more on. And so those are available for that. That's designed to pay for 100% of the cost on virtually all frames. Certainly there are some of the higher end designer frames that you might go out there. I've seen them cost as much as $400. Those aren't going to be covered in full, but you'll still have the $150 allowance or the $170 allowance there. And then the corrective lenses. So the lenses are covered in full as well. So really, for the vast majority of you, you'll be able to go to get a new pair of glasses, new frames, new lenses once a year, going to be covered in full. There's some additional benefits around this on the next slide here, which have been added in. And this is sometimes where you can get a lot of gotchas in cost when you go to a provider. So the UV coating, that's really a big one now for, kind of covering when you're on a computer, just out in the sunlight, those kinds of things. The different types of lenses like the polycarbonate, the scratch resistant coatings, they always ask you, do you want those? And it's like, well, maybe I do, maybe I don't. Well, it's going to be $22. Sometimes it's added cost for this one. These are available, and as long as you're going to an in-network provider, they're going to be generally covered in full. Anti-reflective coating, all of those different things are going to be available to you. So, and then the last thing we talked about with the frame allowance, I didn't mention on the prior slide, if you do happen to choose a frame that is over the frame allowance, you are going to have a discount of the 20%, which helps every little bit's going to help, right? So really designed to minimize the cost here as much as we possibly can. So I strongly recommend you check that out. Great benefit. I mean, I wish I had this benefit. Honestly, my vision doesn't even come close to covering this much stuff. So looking for providers, same strategy as you do on the dental. So you can either go to metlife.com, or you can go into your My Benefits login and you can search there. Instead of searching find a dentist, just find a vision provider. And then it'll take you into the next screen. This is where you're going to have to pay attention a little bit because there are 5 different plans. VSP Choice is the plan that you are covered under. And these do have different networks. There's a lot of overlap between them, but there are some unique providers in each of the networks. So definitely make sure you click on the VSP Choice. It's in the materials and things like that. So if you don't write it down, you forget, no problem. You'll be able to find it there as well. But you click on that, same idea. It'll give you the ability to search by your zip code, your city. If you happen to know a provider, you want to just see if they're in the network, you can search it by that as well. And it'll bring up a listing of available providers. Pick the one you want. And for the vision, you don't have to pre-select a provider. You can just go and they will go ahead and process claims. I know one other question I didn't address on the dental, and I'll get it here, is if I'm going to go use the plan, what am I going to need to fill out? The vision providers or the dentist will take care of the paperwork for you. So you should not have to fill out any forms. They'll file electronically with MetLife. And then, like I said, for vast majority of the cases, there's going to be no out-of-pocket cost. So you won't have to pay anything. You'll just be able to get your services done and be on your way. So I think that brings us to the end of my section.
Neil, thank you very much for all that you brought to the table. Great overview. Marche as well. Now we're here at a very important pivotal point. Hello, everyone. Let's talk about our child care union.
Hola a todos. Ahora es el tiempo de que tenemos que hablar sobre nuestra unión.
So this is a time where, I get to share a little bit about myself. My name is Horst Turner. I'm a child care provider out of Stanislaus County. I started 14 years ago with Alicia Turner as her spouse. And it was an unbelievable time back in 2010 when we officially opened up in Newman, California. And that journey has gone on, and we had life issues happen, and it made me understand what I enjoyed the most. Why am I working for the rat race outside of the world? I joined and opened up my own childcare with Alicia Turner support. And that was 7 years where I was supporting her as a spouse. And then I became an official childcare provider, running my own facility, loving, understanding the union and my background. I was able to step in where Alicia says, this is for you. And I can't tell you, everything that we've received and the momentum is fabulous, where we were able to unionize as providers across California with CCPU. And that has brought us a lot of momentum, a lot of achievements that we've been fighting for over 20 plus years. And I can say I'm happy to be part of that because I'm a very active member on the collective bargaining team, not for the first, but for the first, the second, and now just reelected for the third session. Part of the part of the healthcare chair, as we are talking about the healthcare right now. And I additionally hold the chair for the training advisory board. So I put myself as pride, being very active to be a spokesperson.
Gracias, Horace. Mi nombre es Patricia Morán. Tengo mi daycare, soy proveedora de cuidado infantil en la ciudad de San José, del condado de Santa Clara. Yo también hace muchos años empecé con la carrera del cuidado infantil, del desarrollo del niño. Y por muchas circunstancias empecé a trabajar en una agencia aquí en San José. Y esta agencia cerró, pero yo me di cuenta cómo las proveedoras trabajaban tan duro y eran tratadas muy mal. Y no tenían ni beneficios. Cuando salí de eso, yo decidí poner mi propio daycare y con mucha fuerza me uní a la unión para hacer un cambio, un gran cambio para la vida de todos nosotros. Soy parte del equipo de negociaciones. Este es mi tercer año. También soy una parte de la directiva, soy un trustee del Fondo de Salud, como también soy de la directiva del SEIU 521, 521, y estamos aquí, estamos unidos porque hemos querido hacer la diferencia.
That was beautiful, Patricia, and I thank you. Now, I'm sure you guys have noticed the QR code. Let's go back to that screen for 1 second, Marche. So everyone sees that QR code on the left. I want you guys to go ahead and scan that right now. Let's access the membership, the application right now. You can start by filling that application as we continue to speak.
Ustedes están viendo en una esquina del slide el QR code para que ustedes lo puedan escanear para obtener acceso para la aplicación de la membresía para ser parte de CCPU. Ustedes lo pueden estar haciendo mientras nosotros continuamos hablando.
Go ahead, next page. So you may ask yourself, what is our union? A union is made up of providers coming together to win improvements in the profession and in our communities. That's exactly what providers are doing. Providers won historical union election and our first contract with the state with over 97% of the vote, yes, during the pandemic. After 17 years of the fight for our union, with our union, we now have a seat at the table. We're able to provide input and our suggestions on how to make our system work better for our providers, children and family, the state and the agencies with contract with no longer can make unilateral decisions on the impact of our work and our livelihoods. We have a collective bargain rights now.
¿Qué es nuestra unión? Una unión está formada por proveedores que se juntan para lograr mejoras en su profesión y en sus comunidades. Y eso es exactamente lo que están haciendo los proveedores. Los proveedores ganamos unas elecciones de unión históricas. Y nuestro primer contrato con el Estado, con más del 97% de votos sí, durante una pandemia. Después de 17 años de luchar por nuestra unión, con nuestra unión ahora tenemos un asiento en la mesa donde podemos dar nuestra opinión, nuestras sugerencias sobre cómo hacer que el sistema funcione para los proveedores, los niños y las familias. El Estado y las agencias con las que contratamos ya no pueden tomar decisiones unilaterales que afectan a nuestro trabajo y a nuestro sustento. Ahora tenemos derechos de negociación colectiva.
Who is CCPU? Child Care Providers United. It is CCPU. It is formed of 4,000 early childhood educators across California. We are a combination of 3 separate unions, which are SEIU Local 99, SEIU Local 521, and UDW Local 3930. We belong to both our local union and CCPU. Together, we advocate for ourselves and our families we serve as a single powerful organization. We accomplish this by taking collective actions to improve the quality of our profession as early educators. Let me say that again, as early childhood educators. By improving the living wages, we will improve our living wages, right? And the benefits we provide for providers and making the service affordable for all low-income families.
Y me orgullece compartir que nuestra unión de proveedores de cuidado infantil incluye más de 40,000 educadores de la primera infancia en California. Se juntan en nuestra unión, Child Care Providers United, CCPU. Pertenecemos tanto a nuestras respectivas uniones locales, SEIU local 521, SEIU local 99 y UDW como a CCPU para poder hacer cambios a nivel local y estatal. Actuamos unidos, colectivamente para mejorar la calidad y la asequibilidad del cuidado infantil, así como la paga y los beneficios de todos los educadores de la primera infancia. Estamos comprometidos con el cuidado infantil para todos, de diferentes orígenes, que hablan diferentes idiomas en todos los condados y todos los tipos de cuidado que se dan. Y de todo tipo de licencia.
We're stronger together. Let's take a look at this image of the fish. What do you see? What comes to mind when you see this? So you see the small fish represents us, child care providers. Without a union, we are only a single small fish. Having to sort through all the issues, the agencies, the R&Rs, and the state licensings are other challenges that we might experience. But with all of us coming together in the union, we are something great. We are united and collectively able to take actions towards a common goal. We're stronger together.
Unidos somos más fuertes. Observa esta imagen del pez. ¿Qué ven? ¿Qué te viene a la mente cuando ves esto? El pez pequeño nos representa a nosotros, los proveedores de servicio de cuidado infantil. Sin una unión, estamos solos. Somos un pez pequeño que tiene que resolver problemas con las agencias, con el Estado u otros problemas que podamos tener. Pero si todos nos unimos en nuestra unión, formamos algo más grande. Estamos unidos y podemos actuar colectivamente para alcanzar una meta común. Juntos somos más fuertes.
What we won so far, we all know as early childhood educators. Our pay has been low and our work in this profession has been marginalized. But with the power of our union, we receive wage increases and a pathway towards reimbursing us, childcare providers, for the actual cost of care. We now have benefits like healthcare reimbursements, dental and vision, retirement fund, education, training, and professional development like this webinar here tonight. Now, our voices are heard regarding improvements to California childcare systems. We are now paid on enrollment, not attendance. 25 hours is now considered a full-time enrollment. And families, during the COVID process, we now have protection that are in place that wasn't in place before COVID. Did you know that 6,000 providers had to close their doors during the pandemic because of the protections were not in place during that pandemic?
El poder de nuestra unión nos ha hecho ganar. aumentos salariales y una vía para conectar los reembolsos con los costos reales del cuidado de los proveedores. Los beneficios para estabilizar proporcionan reembolsos de la atención médica, dental y visión, fondos de jubilación y entrenamiento y desarrollo profesional. Mejoras al sistema estatal del cuidado infantil. Pagos por inscripción, no por asistencia. Menos horas para calificar a cuidado a tiempo completo. Ahora son 25 horas de cuidado para calificar a tiempo completo. Protecciones contra el COVID. Muchos de nosotros sabemos que hay muchas proveedoras que han cerrado durante la pandemia porque no habían protecciones, no estaban en ese momento, pero ahora ya tenemos mucha protección.
Now our future depends on all of us. How do we continue to win? Well, the future is our union. Our careers, our livelihood, all depends on us. We have to, 1, grow our membership. 2, recruit leaders. And we have a lot of leaders, but we need more. 3, ensure that we have the resources and power to continue winning. Ride that wave that we have.
El gobernador y el estado de California no solo nos han dado mejores salarios, jubilación y atención médica. ¿Cómo ganamos? Bueno, el futuro de nuestra unión, nuestras carreras y nuestro sustento depende de todos nosotros. Aumentando el número de miembros, reclutando líderes, asegurando que tenemos los recursos y el poder para seguir ganando. Juntos podemos asegurar que los proveedores dedicados tengan los mismos beneficios y protecciones básicas que otros trabajadores esenciales. Seguimos construyendo nuestra unión para hacernos más fuertes y conseguir lo que necesitamos los proveedores de cuidado infantil y las familias. Nuestro futuro depende de todos nosotros. Unidos somos más fuertes.
So as you see, stronger together. So once again, we're showing you that QR code. Click if you hadn't done so already. Scan the code to start filling out the application where you can join today. For those who don't have access to clicking, we sent it on the chat to download the link. Click so we can accomplish more together with our team. So make sure you click.
Y el primer paso para ganar es asegurarnos que todos los proveedores se inscriban como miembros de nuestra unión. Asegurémonos de completar la solicitud en línea y enviársela a los proveedores que conocemos. Tenemos en la pantalla, en el slide, a una esquina, el QR code para poder hacer la inscripción.
You can count on me to make our union stronger and more powerful. For those of you who have already made it to become members, and also I'm counting on you too. We need you to sign up. We need you to call other providers to share the updates. We need to recruit new providers to join and or host a meeting and invite other providers who know and are not members and have them join. We need your voice and your commitment to keep us moving forward, to keep us strong.
Cuenten conmigo para construir una unión fuerte y poderosa. Nuestra unión es como un gimnasio. Solo veremos resultados si estamos activos. debería aparecer una encuesta y si no es así, puedes compartir en el chat cómo puedes participar. Elige una o todas las opciones. Unirme a nuestra unión, CCPU, inscríbeme, llamar a otras proveedoras para compartir actualizaciones y movilizar a la acción, o reclutar nuevos proveedores para nuestra unión, o todas las opciones.
Our vision for California.
Hey, Horace, so I'm going to launch the poll.
Oh, okay.
So yeah, if we could go back to the previous slide.
Yeah.
And I'm going to launch the poll. I'm going to keep it open for about a minute so folks can choose the option that they would like to, how they would like to get involved. So I'm seeing a lot of responses for folks. It looks like a lot of folks want to be able to recruit new members. Folks are also interested in sharing their healthcare story. And a lot of folks also want to do all the above, which is host a meeting, recruit new members, share their story, and speak with their legislators. So that's great to see, everybody. So we're going to leave the poll open for about another 30 seconds. So if you haven't answered the poll, please complete it, and then we're going to share the results here. Okay, so it looks like a couple more responses are coming in. So I'm about to end the poll and share the results so folks can see. Horace, would you like to go over the results?
My pleasure. I want to get involved. We have 23% speaking to legislators. Healthcare stories, we have 23%. Recruit new members. That's a beautiful upgrade where we have 47%. Hosting house meetings, we have 15%. All the above, 18. And I know we didn't get everyone to vote. So let's keep pushing this forth. This is how we're going to create our vision for California. Thank you, everyone who had a chance to participate in the poll. If we can go next slide, excellent. Our vision for California future. I want to share our vision. We are CCPU. So when I say our vision, it's not an individual vision, but it's our providers union vision. We together make up the union and our vision. We need everyone, child, to have access to quality childcare, and for all of us, providers, to ensure that we are respected and have the quality of jobs, living wages, benefits, and training opportunities.
Es muy importante saber nuestra visión. Nuestra visión, la visión de CCPU no solamente es visión individual, es la visión de todas las proveedoras. Es una visión de la unión, que nosotras juntos podemos hacer nuestra unión y que nuestra visión se realice. Necesitamos que cada niño, todos los niños tengan un acceso a un cuidado de calidad, un cuidado de calidad, pero como nosotros los damos. Y para nosotras, las proveedoras, los proveedores, tenemos que estar seguros que seamos respetados y que tengamos una calidad de trabajo, de los salarios que nos den, de beneficios y entrenamientos y oportunidades.
To stay in touch. Finally, you can stay connected by following us on social media, pages on Facebook, Instagram, and at CCPU California, or on our website at childcareprovidedunited.org.
Estemos conectados por medio de de social media. En Facebook, con CCPU California, Instagram, CCPU California, y con nuestra página del web, que es childcareprovidersunited.org.
Now, my brothers and sisters, we have concluded our meeting as in providing information, but it's not over just yet. We have questions and answers to be able to ask some of the common questions. But I want to remind everyone that's here, you need to take action. We need to take action. And this is where we take control of this momentum that we have. So as we go into question and answers for our benefits, I want you guys to understand this. Everything that has been talked about, put in the chat are the question and answers. If we're unable or we have not answered your question, it has and will be recorded for us to reach out and get in contact with you.
Hermanos y hermanas, compañeros, compañeras, estamos llegando a un momento muy importante, que es la respuesta a sus preguntas. Si no podemos contestarlas en este momento, van a estar grabadas para poderles contestar a cada una de las preguntas que ustedes tengan. Pero recuerden, es muy importante estar comprometido en nuestra visión, en estar juntos en nuestra lucha, porque hemos logrado bastante, pero no es suficiente. Necesitamos mucho más y que seamos valorados y que seamos respetados. Y los únicos que podemos hacerlos es nosotros, por medio de nuestra unión, porque sí podemos y sí se puede. Sí, lo vamos a lograr y lo lograremos.
And now it gives me great pleasure to bring back Marche and Neil for some question and answers.
Awesome. Thank you, Horace, and thank you, Patricia. So I'm going to answer a few questions with Neil, and they're based off the questions that have actually popped up in the chat while the presentation was going on. So I will take the first one. So good afternoon. Other than these two options for vision and dental, are there other medical plans available? Okay, so what you want to remember, everybody, is that the CCPU healthcare reimbursement benefit in this plan is not a health plan. So we don't actually offer health insurance. Providers actually have to have health insurance as one of the eligibility criteria to be in the program. So with that being said, very important to remember that when the Board of Trustees was actually creating the criteria for the program, they were very strategic in designing it to accept a wide array of plans. What that translates to for you is that there are many, many plan types that we do accept. And so if we get maybe a more specific question about a specific plan type, I can confirm to you that we take it. But for the most part, whether it be a Covered California Silver HMO, an employer-sponsored plan, a Medicare plan, a Medi-Cal plan, TRICARE, veterans, etc. We typically take all types of medical plans. We want to be inclusive. Okay, so the next one is for you, Neil. The provider says, my MetLife card only says dental. Can I use it for vision too?
Yeah, great question. Actually, you don't need a card for the vision coverage. Only the dental has an ID card. The vision does not require one. So you are more than welcome to just find your provider that you want to go to that's in the network. And you can go see them and utilize your benefits that way. They will be able to identify you in the system. So they have a system that they electronically can look up with MetLife, and they can see you there, and you'll be able to tap into the coverage that way.
Awesome. Thanks, Neil.
Yeah.
All right. So another question that I got was, what if you have a Covered California Blue Shield Silver PPO? Okay, so this question has two answers. So the only way this program will accept a Covered California PPO plan is if there are no HMOs available in your area. With that being said, if you are on a PPO plan and you have an HMO in your area, Covered California will allow you to make a plan change outside of normal open enrollment. So if you contact Covered California and let them know that you're a child care provider, they've partnered with this program to allow child care providers to change their plans into silver HMOs. The key word to give them is that you have a stipend QLE. So again, if you are a child care provider in a Covered California plan that is not a silver HMO, you want to contact Covered California, mention you are a child care provider, and that you are requesting a stipend QLE. And QLE stands for Qualified Life Event. All right, the part two of this is, does the bronze plan not qualify for reimbursement? Same concept. If it's Covered California, it must be a silver level HMO. So again, you want to make a switch if you are not in a silver level HMO. All right, next question. Do the dental procedures come out of the $9,450 reimbursement allotment, or does dental have its own budget? All right, so I'm going to answer part of this, and then I'll maybe let Neil touch on some of the out-of-pocket maybe maxes for dental plans, the dental plans. So with the 9450, it's really important that everybody understand that the healthcare reimbursement fund that comes with either permissible premium reimbursement or out-of-pocket reimbursement that gives you a debit card, it's a completely separate benefit than dental and vision. So with that being said, if you have an out-of-pocket benefit with your healthcare reimbursement benefit, you cannot use your CCPU debit card to pay for out-of-pocket dental and vision costs. And it's very important that you understand that this applies to out-of-pocket. If you are on Medi-Cal or Medi-Medi, you do have an opportunity to use your CCPU debit card to help pay for dental and vision expenses, but only if you're on a Medi-Cal or Medi-Medi plan. And so Neil, can you maybe talk to the providers a little bit about the out-of-pocket maximums for the two dental plans that are offered?
Sure. So for, like, once again, for the vast majority of you, somewhere around 97%, you're going to be on the DHMO plan. The DHMO plan has no annual maximum, so you can't exhaust the benefits. And, you know, if you are unfortunate, you have to go for a lot of dental work, you know, a couple of crowns and a root canal and all kinds of stuff, you're going to be able to use the benefit plan no matter how much of that you're going to use throughout the year. So for the few of you that live in areas where there is no DHMO and you're on the PPO plan, that's where you will have an annual maximum that is $1,000 worth of benefit. So for most folks, you know, if you're going in for cleanings, maybe a tooth extraction, x-rays, exams, those things, that should be more than adequate to cover it. And it's both of them are designed to cover it 100% of the charges that are there. So, you know, for virtually everybody, you're going to have no out of pocket. So you're not going to need even to want to tap into any other funds, because it's going to be covering the costs that you're going to have at the dentist.
All right, thanks, Neil. Okay, another question I got is annually based on the enrollment date, January through December or July through June? So if we're talking about the benefits and the sort of the monies that you spend, it is a regular old calendar year, which is 1/1 to 12/31. So even if you were to get into this program, let's say in June, right, you're still going to get $9,450 to spend for the remaining 6 months. We do not prorate those buckets. Hopefully that answers that question. Neil, how about I ask you this one? For dental and vision, can our childcare providers choose to be in a PPO or a DHMO?
So they will not choose between them. So there's one vision plan for everybody, so you don't need to worry about the choice there. And then for the PPO and the HMO on the dental side, you will be assigned by access. So the only folks that will be in the PPO plan would be somebody who doesn't have adequate access under the DHMO plan.
Right, and that's accurate. And I think we're defining access by there is no PPO provider, I believe, within 15-mile radius.
HMO provider, yeah, within, I think it is, I think you're correct. I think it was 15 miles. And once again, we're monitoring this on a quarterly basis. So if you happen to have access and maybe a dentist that you were using that was in the network retired, and now there's no dentist within radius, you would then have you would be moved into the PPO plan if that were the case. That won't happen very often because there's so many DHMO providers out there, but if you live in a fairly rural area, it certainly could be the case.
Right, thank you for the correction. It's 15-mile radius to have a DHMO, and if you don't, yep, and if you don't have one, is when you would default into a PPO. So there is no choice.
Yep.
All right, I see a couple of questions surrounding this, so I'll tackle this. What about if there's two people on the same license? Are both providers entitled to benefits? So currently the rules that are set by the fund is that it's one provider per license, first come, first serve. And you can switch who gets benefits at the beginning of a program or a benefit year. So if Neil and I are doing business together and we are sharing a license as childcare providers, it's me and Neil running to get benefits and whoever gets them first. So currently, both providers on a license would not be eligible, only one of the two. And if I decide this year it's going to be me, we could decide in 2025, it'll be Neil. So one provider per license, and you can switch at the beginning of a program year. All right, so here's a question surrounding dental and vision. Medi-Cal does not cover certain procedures, and I'm currently paying for an implant procedure with a credit card. Would this dental service help me? So let's start there. Neil, are implants covered under the dental plans?
So the implants are not covered under this dental plan. There are some adjacent coverages that you may be able to use. You know, without knowing what kind of treatment patterns you're doing or history you've got going, I would recommend once you get signed up for the program to go talk to your provider, your dentist who's doing the work, and have them find out. It's very simple for them to let you know if there's going to be some coverage, but the actual implant itself is not going to be covered. Also, one other thing to note is that any services that are completed prior to your enrollment or your eligibility date would not be eligible for submission for coverage. So if you've had something done here in September and you become eligible in October, the plan's not going to be able to cover it, even if it is a covered service.
Got it. And the follow-up question, Neil, is concerning vision, does the vision benefit cover laser surgery?
Yeah, the vision plan does not cover LASIK surgery. It's designed to cover kind of your normal usage, glasses, those kinds of things.
Got it. All right, so next question. I have 4 subsidized children right now. What happens if I lose them? Will there be a gap in coverage until I pick up another subsidized child? This is an excellent question. So remember when we talked about eligibility criteria, and I talked about needing to have 3 months of subsidized payments out of 6 to get initial eligibility. And then after that, you have to maintain at least 1 subsidized child on your roster and get paid for them at least 1 month out of 3 as the program goes on in order to maintain eligibility. The wonderful thing about this program, everybody, is that, again, your board of trustees is made up of childcare providers like you. So they understand that your roster of children fluctuates and changes throughout the year. So because of that, they actually have what we call a grace period that is available to all childcare providers, and you're able to actually utilize this once per program year. And it actually is in place for providers who may lose a child on their roster. So for instance, if you go 3 months throughout the year consecutively without actually having a child on your roster that you get that receives subsidized payments, we will grant you a grace period and continue your benefit. You only run into issues with your eligibility if you go 6 months without having a subsidized child on your roster. So hopefully that answers the question. We do grant grace periods if you drop a child for 3 months. And then if you do lose coverage, of course, you do have the ability to come back into the program once you pick children up again. Okay, let's see. Can we use our CCPU fund visa for dental care? So we kind of went over this just a little bit, and I'll just kind of reiterate it, and this will be the last question that we take because we're at time. So as a reminder, everybody, the healthcare reimbursement fund benefits are separate from the dental and vision benefits. However, you have to be enrolled and approved and active in the healthcare reimbursement program in order to actually get access to those dental and vision benefits. They come together, but they are still 2 separate and distinct benefits. With that being said, because the reimbursement, medical reimbursement program that issues that debit card pertains to medical expenses, and the dental and vision benefits that are administered through MetLife are completely separate. You cannot use your debit card to pay for dental and vision costs unless you're on Medi-Cal or Medi-Medi. All right. Okay, so I note that there may be some questions that we didn't get to that were specific. Here is our desire. If you have not gotten an answer to your question, or you haven't put it in the chat so that we can actually capture it and follow up, I highly recommend anyone who needs follow-up to email myself and my team at apply@ccpuhealth.org. And if you haven't put it in the chat so we've captured it, or you have a question that you need us to still follow up on that you didn't get answered, or entered into the chat for us to follow up, send the questions there. And if they're MetLife questions, I'll coordinate with Neil and his team to get an answer out. And if they are specific to the healthcare reimbursement fund, I will have my team reach out and assist. So with that, I will go ahead and turn it back over to Horace and Patricia to take us home.
Thank you, Neil and Marche. That was an awesome opportunity. And thank you to those providers who stuck in and stayed to the end, because all those questions regarding benefits of what we fought for, remind you, we've changed, we made history, but we're not satisfied. It's not over yet. And this is the call to action. We need everyone that knows who's active and who is not active to become active. We need everyone to be at the table, everyone to be ready to take action. So become a union member. We need the numbers. We need you to contact us. Follow up the information about CCPU Healthcare Fund reimbursement programs. Please visit our website at ccpuhealthcare.org and sign up for the updates and texts and emails. You can also email support@ccpuhealth.org or call 833-714-6028 to speak with a customer service representative. Now, understand the call centers at this time is Monday through Friday from 8 a.m. to 5 p.m. But rest assured, as we get more providers, we will be developing, enriching our programs, our benefits to provide more for us providers and our family members.
Sí, gracias, Horace. Y recuerden, ¿cómo comenzamos? No teníamos nada, pero por la lucha, por estar unidas, por estar más juntas, a invitar compañeras, hemos crecido tanto. Lo hemos hecho más grande y estamos logrando mucho, pero no es suficiente. Tenemos que seguir adelante. Ha sido muy linda la información. Si ustedes quieren tener más información, pueden ir a ccpuhealth.org o support.ccpuhealth.org y el número de teléfono es 833-714-6028. También pueden visitar la página web de medlife.com para info/CCPU y el teléfono del beneficio dental es 800-438-6388 y de visión es 855-638-3931. También pueden escanear a este código que está para ingresar para obtener más información. Como dije antes, si lo pudimos hacer, lo vamos a seguir logrando porque sí, eso sí, sí se puede. We can do it. Podemos hacerlo y llegaremos a más, pero unidos, unidas. Hay muchas compañeras que desean unirse, invitémoslas. Gracias, buenas noches.
And again, if your questions were not answered, we will leave the chat and this screen up for the next 2 minutes. So please feel free to document your question so we can reach out and remind you to take action because our future depends on it.
Se va a mantener abierto el chat para que pongan las preguntas para que nosotros podamos responderlas. Gracias.
Where's that wonderful music, Marche?
Come and write it.
We are family. We let that play one time and then we'll close it all out, everyone. So now's the time to put every question down in the chat so we can reach out to you.